Hello and welcome back. In this lecture, we're going to be discussing Chapter 5 and Chapter 6. In Chapter 5, we're discussing working with diverse populations, and in Chapter 6, we're discussing the assessment phase of case management. So, working with diverse populations. Again, we're in a world today where we can't get around working with diverse populations because diversity is so fluent within our society. And when we talk about diversity, we're talking about all those different factors of culture: age, race, sexual orientation, gender, social economic status, religion. Again, a multitude of cultural factors that all play a role in create diverse populations. So the importance of cultural competence. That's understanding and respecting cultural, ethnical, and social economic differences. Again, understanding that each client is unique and has their own perspective. And just because they have a certain look or a certain gender or a certain presentation or whatnot doesn't mean they adhere to certain practices. So we want to make sure we find out about that client's cultural, ethnic, and social economic differences. We want to build trust and rapport. And we want to have effective communication, decision making, and service outcomes, which are all driven by being culturally aware of our clients and again respecting their diversity. So to do so, self-awareness becomes very important. Case managers must examine your own biases, beliefs, and cultural worldviews, and commitment to lifelong learning and reflection. So again, having your own biases. I've worked with a lot of different clinicians and a lot of different case managers that are not aware of their own biases because again self reflection hasn't happened, and it's really important because when things are implicit and you're not aware of certain biases, you have automatic mental association towards certain people and beliefs. We all have been raised differently. We all have had certain different experiences and grew up with different values and morals and whatnot. Those morals and values could definitely create certain biases in certain area, and it doesn't make you a bad person to have a bias. It makes you a more effective clinician to be aware of your biases and your beliefs, right? And also your cultural worldview, which is what kind of guides how you see things, how you reflect things. From a cognitive behavioral standpoint, it says that we don't respond to the situation, we respond to how we perceive that situation. That's based on our cultural worldview, things that we've experienced and things that how we've inherited certain belief systems. So key areas of diversity you want to look at, like I said, there's a multitude of different cultural factors, race and ethnicity, which are different, right? So again, we don't want to have because a person of a certain race doesn't mean they have a certain ethnicity. We want to look at both backgrounds, gender identity and sexual orientation, social economic status, disability, religion, spirituality, language, or immigration status. All those things are these are all key areas of an individual, and all can impact the individual differently. That's why we have that respectful model that breaks down all those different areas of culture, which can all influence a person's behavior or worldview differently or have bigger impacts. One of these areas can impact a person more than other areas. So we really want to make sure that we look at the whole person and we gather information to and see which area of diversity can impact that person's behavior or circumstances the most. So best practices with working with diversity in clients. You want to use inclusive language the client to understand. Make sure that you're talking in a manner where the client can get the information from you, right? You want to practice active listening and empathy. Those are micro um, counseling skills that go across no matter what case managers or counselors or treatment providers are doing or whatnot. You want to be able to listen to the client, make the client feel heard, and understand how the client feels. Not meaning that you want not understand the client's experiences because it can be very invalidating for someone to say that I understand what you're going through, right? But you definitely can understand how someone feels because we can all go through the same thing and always have a different feeling about it. I always have a different outcome about it or can perceive things differently. We want to adapt communication styles when needed because, again, we want to adapt the communication style to where a client can understand and they can feel heard. You want to involve interpreters when appropriate. Again, language is very important. You want to make sure that you're using, you're communicating with the client to the point where they can understand you and you can understand them. You want to understand and integrate cultural values into service planning, right? You want to make sure that you're using an approach that is going to meet that client's need and provide information for that client and get information for that client and give them resources that's going to actually be integrated into their cultural values. Ethical considerations. We want to adhere to the NASW Code of Ethics and similar guidelines, making sure that we're making the correct decisions for our client, and it's not about us; it's about the client, and all our decisions, the decisions that we're going to make are going to be ethically driven towards meeting the client's needs and not hurting the client, giving the client autonomy, treating the client with justice and fidelity, treating the client, not doing any harm to the client. We want to avoid using stereotypes or making assumptions. Again, we don't want to put anybody in a box. Just because a person looks a certain way or have a certain gender or have a certain sexual orientation or have a certain religion or whatnot does not mean they actually believe and think a certain way. Right now, so you want to make sure that you view that client as a unique person and you understand what their culture is. And lastly, you want to promote client self-determination within a cultural context. Again, you want to help that client build their self-motivation and their determination or whatnot within their own cultural context, so they can actually obtain the information and move with the information and grow with whatever you're trying to do in their service plan or whatnot within their cultural context. Now let's move on to chapter 6, the assessment phase of case management. In the assessment phase of case management, this is information gathering and finding information that we can help that can help us paint a picture for the client clinically or whatnot, where we can have understand what they need and what resources that we need to attach them to. So the purpose of assessment is to gather comprehensive information about the clients, their needs, areas where they need the areas where they have expectations of things that they have to survive, their strengths, what are their abilities, what are things they're good at, resources, things that are currently in their system or currently available to them, and their challenges, what are barriers they have. Right now, they can keep them from actually obtaining those resources or getting their needs met or seeing what their strengths are, right? These four things that we're gathering information on form the foundation of the service plan. So components of a good assessment: the client history, the presenting problem, social supports, environmental context, and cultural considerations, and client goals and motivation. So the client history is going to be the history of the client with their background, their upbringing, their demographic factors. The presenting problem is going to be the issues that actually bringing them into case management. The social supports, what supports are available for them, what does their support network look like, who are their immediate family members or immediate friends or immediate environment that can be supports for them. Their environmental context, let's look at their whole environment and see what is involved in their environment, what are the barriers and strengths of that. Cultural considerations, again, looking at their respectful model, looking at all those different factors of culture that we just discussed that play a role for the client, and their client goals and motivation. What are they here for? What are they trying to do? So client involvement in the assessment. So this has to be a collaborative process. The client has to have some feet into this thing. They have to be active and engaged into it, right? So that they're experts on their own lives, right? They are they're the one in the room that has all the information. Who knows more about you than you, right? So, and we want to encourage empowerment and buy-in. We want to empower the client to help themselves. That's what our role is. We want to help the client help themselves to again build that level of autonomy that we're trying to build with the client. And we want to build trust through transparency. We want to be very transparent and open and honest and direct and genuine with the client, so they can actually trust the process and trust that we're going to be there and do the job that we said that we're going to do, right? And being transparent helps you build trust because transparency is consistent. So tools and methods. In interviews and intake forms, every agency or different setting has different interview or intake forms to help you gather that information. Observation, you want to observe the client. You want to see some of the things that are discussed within the assessment for yourself. Standardized assessments, and also observation can come from external factors as well, right? Standardized assessments, again, some if applicable, some agencies have some standardized assessments that they utilize to help strengthen the information that's gathered and collected for decision making. And collateral information you want to use from other professionals or family members. You want to obtain different information outside of the client to help actually gather more information and again help with that clinical picture that we're trying to make to help paint that picture for that service plan. So strength-based and person-centered approaches. So we want to focus on the client's capabilities in strength-based or person-centered approaches. We want to see what we know what their deficits are because they're kind of letting us know what their deficits are, but then they're presenting a problem. But what capabilities do they have? What are things that work? When things were good, what was going on and what strengths did they have? Right? We want to see what their strengths are so we can actually utilize those in areas where they have deficits. We want to have clients have defined goals. We want the client to define goals that are obtainable, that are measurable, right? That are something that's realistic, right? So that we can actually achieve those goals. Then we want to be culturally relevant. Resilience factors. Resiliency is huge, right? Resilience is the ability to bounce back. So we want to make sure that all our clients have that ability to bounce back, and we want to make sure it's culturally relevant. Where does that resilience come from? Is it a certain belief system, certain religion? Is it a certain family? Is it certain factors that they have that help them become more resilient? So documentation and confidentiality, very important. Again, we want to make sure that our records are accurate and detailed. We want to make sure that they're stored in our EMRs or on our record keeping processes or whatnot. That they are fully have all the information needed to actually support and actually show the work that we've done with the client. We want to respect the client privacy, making sure that we're protecting their rights for privacy and not exposing their confidential information in matters where it's not appropriate. We also want to make sure we're in compliance with HIPAA and policy and agency policy. So we need to be aware of HIPAA standards and our agency's policies when it comes to confidentiality. Because again, privileged health information needs to be protected because it's the client's right to have that protected. Right? They're here for us to receive support and for us to act within the confidentiality processes of HIPAA and your agency. Finally, assessment is more than just gathering facts. It's building that partnership. It's creating that clinical picture so you can help the client. And also, it allows the client to have some feet in it and work with you as a partner and not just a person that's actually actively trying to find resources or attach them to resources. And cultural awareness is essential throughout the process. Again, viewing that client as a unique person with unique circumstances and seeing how those different cultural factors impact the client is very important. And a thorough person-centered assessment, guys, is ethical and effective intervention. So again, that thorough person-centered assessment helps us gather all the information we need. It helps us to actually become culturally relevant. It keeps us ethical, and it creates an effective intervention because we have a clinical picture that we can utilize to help the client.